It's 7:44 right now on your Wednesday morning, a health alert for you at home. Even if you just went to the doctor and they said, oh, your blood pressure's good, well, that might not be true anymore. The reason is the guidelines, they've just been changed. It happened at the American Heart Association conference this week. There is now a lower threshold for what qualifies as hypertension. The definition of the word has changed. It means half of all U.S. adults are now considered to have high blood pressure. It's the first time in 14 years that high blood pressure is being redefined. Dr. Rhea Pitts is here to tell us more about these new guidelines and what this means for us. Doctor, good to have you.
Hi.
You know, as soon as I heard these new numbers and this new information, I thought to myself, we got to get somebody to break this down for us, because what does this mean for Joe Blow, you know, the mom at home sitting there watching right now? What does it mean?
Well, it really means that they could be at risk and that they should be aware of their risk factors. The first thing people should do is consider seeing their doctor to get their blood pressure measured and to see whether they have hypertension or high blood pressure, whether they now meet the criteria, the new criteria for hypertension.
Well, and it doesn't change, I mean, the actual threat here necessarily. It just changes how it's defined. Do you think the new guidelines make more sense?
I think so. We've always known that hypertension is such a strong risk factor for heart disease and stroke. And we know that that risk doubles when you go from a blood pressure of 120 to 130. And so it makes sense that we lower this threshold so we can capture more people within this diagnosis and treat them appropriately.
Good. I mean, with this, is it a good time, a good reminder for people to think about blood pressure and think about maybe getting to the doctor and just kind of getting things checked out? Absolutely.
They should see their doctor. They should get their blood pressure checked and see what kind of changes they should make within their life to improve their risk and their blood pressure.
Well, you know, a lot of us think, oh my gosh, that's for old people. I mean, heart risk. I mean, I'm in my 30s. I don't have to worry about it. Is that true?
No, that's not true at all. I see heart disease and stroke in my younger patients in their 30s and their 40s. And so whether you're in your 20s or in your 30s or 40s, you should definitely be screened because we're just at higher risk now.
Do you think it's one of those things that people don't think about it until it's maybe too late or at least too far along in the process?
Yeah, absolutely. We see it when people go into the emergency room for other things, and then they have high blood pressure that they weren't aware of. So so by that time, we could have done things much earlier to combat their hypertension. That doesn't involve medications.
Right. Because once you get that far along, it becomes a lot more difficult. And I'm sure there's a long list of symptoms or signs, but if there's one thing that people can just maybe keep an eye out for in their life that might be a sign that something's going on.
Actually, no. You know, hypertension is a silent killer. We kind of know this where you don't have any symptoms. And so it kind of creeps up on you, and that's why it's very important you get screened.
Because I guess the symptom would be you're having a heart attack.
That or stroke.
Right, you're having a stroke, so it's almost too late. So you really need to get into the doctor.
Absolutely.
That's actually an even better answer, because that, I think, really drives home how much of a silent killer this is. Well, thank you so much.
Yeah, thank you so
Are you
much.
hoping that this raises awareness?
Yes, and I think it already has. I think that we've seen it in the news, we've seen it in regular conversations, and I think that's the whole idea, is to raise awareness.
And you are at North Suburban, right, in Thornton?
Mm-hmm.
Awesome. So if you want to see her, you just have to book an appointment. I don't know how busy you are, but Doctor, thank you so much.
Thank you so much for having me.
A pleasure having you. Helps to kind of break down the nuts and bolts of what we're dealing with these new guidelines. Let's get over to meteorologist Greg Dutra, who is watching, starting to watch your weekend forecast.
And it's looking okay for the weekend, just a bit cooler.